Intro and hook. Let's be honest, for years we've been told that miserable, heavy periods are just part of the deal. A normal thing we just have to endure. But what if the constant exhaustion, the anxiety about leaking through your clothes, and having to plan your life around your cycle are actually signs of a medical condition that needs attention? If you are so tired of just powering through your period, then this video is for you. We're about to get real about a topic that is dismissed way too often. So many of us suffer in silence, thinking that debilitating pain and super heavy bleeding are just our cross to bear. But the truth is, while this experience is common, it is not always normal. Your pain is real, your frustration is valid, and there are often diagnosable reasons why your period feels so completely overwhelming. This isn't just about being uncomfortable, it's about your quality of life. It's time we stop normalizing the suffering and start demanding answers. So, what is heavy, really? Before we get into the why, let's figure out what we're even talking about. The term heavy period can feel pretty subjective. What's a nightmare for you might be a regular Tuesday for someone else. But in the medical world, there's actually a clear definition for heavy menstrual bleeding, also known as menorrhagia. You might officially have it if any of this sounds a little too familiar. You're soaking through a pad or tampon every single hour, for several hours in a row. You have to double up wearing a tampon and a pad at the same time to feel safe. You're setting an alarm to wake up in the middle of the night just to change your protection. Your period drags on for more than 7 days. You're passing blood clots the size of a quarter, or even bigger. You find yourself cancelling plans or skipping daily activities because your period is just too much to manage. And here's a big one that often gets overlooked: you feel constantly tired, weak, lightheaded, or short of breath during or after your period. That could be a sign of anemia, which is a serious complication from losing so much blood every month. If you're nodding along to any of this, that's your body sending you a signal. It's not just a bad period, it's a medical symptom that deserves to be investigated. The real reasons, potential underlying causes. Okay, so you've confirmed your periods are, in fact, heavy. Now for the million-dollar question: why? It's rarely just because. Heavy bleeding is usually a symptom of something else going on. Let's look at some of the most common culprits. Reason number 1, hormonal imbalances. Your hormones, especially estrogen and progesterone, are like the project managers of your menstrual cycle. They're supposed to work in a delicate balance to manage the build-up and shedding of your uterine lining. But when that balance gets thrown off, things can get messy. If you have too much estrogen compared to progesterone, your uterine lining can get extra thick. When your period finally starts, there's just more tissue to shed, leading to a much heavier flow. This can be triggered by a few things. Polycystic ovary syndrome, PCOS, a common hormone disorder that can cause irregular cycles, and when your period does show up, it can arrive with a vengeance. Thyroid issues, an underactive thyroid, or hypothyroidism, is a known troublemaker for periods, often causing them to be much heavier. And ovulation, this is just a fancy word for when your ovaries don't release an egg during a cycle. It's common when you're a teen and during perimenopause. Without ovulation, your body doesn't produce enough progesterone, leading to that imbalance and a heavy, unpredictable period. Reason number 2, uterine fibroids and polyps. Think of your uterus as a tiny, muscular apartment. Sometimes, uninvited guests decide to move in. Fibroids and polyps are basically those uninvited guests. Uterine fibroids, these are non-cancerous growths made of muscle that grow in or on the wall of the uterus. They are incredibly common, affecting up to 80% of women by age 50, though not everyone has symptoms. Depending on where they are, they can cause seriously heavy periods, pelvic pain, and a constant need to pee. Uterine polyps, unlike fibroids, polyps are growths of the uterine lining itself. They are usually benign, but they are notorious for causing heavy bleeding, spotting between periods, and bleeding after menopause. Both of these can physically get in the way of how your uterus is supposed to function, leading directly to a heavier flow. Reason number 3, adenomyosis. This condition is finally getting the attention it deserves, and it can be the source of so much period misery. Adenomyosis is often called the evil sister of endometriosis. It's what happens when the tissue that's supposed to line the inside of your uterus decides to grow into the muscular wall of the uterus instead. During your cycle, this rogue tissue does what it's programmed to do, it thickens and bleeds. But because it's trapped inside the uterine wall, it causes inflammation, swelling, an enlarged uterus, and, you guessed it, incredibly heavy and painful periods. Reason number 4, bleeding disorders. For some people, the issue isn't with their uterus or their hormones, it's with their blood itself. If your blood doesn't clot properly, it's much harder for your body to stop menstrual bleeding. One of the main culprits here is von Willebrand disease, an inherited condition where your blood is missing a specific clotting protein. A lot of people with this don't even know they have it, they just think they've always had terrible, heavy periods. If you've always bled a lot, bruise like a peach, or have a family history of bleeding problems, this is definitely worth bringing up to your doctor. Reason number 5, other medical factors. And finally, a few other things can contribute to a heavier flow. Pregnancy complications. Sudden, heavy, and abnormal bleeding can be a sign of a miscarriage or an ectopic pregnancy. It's so important to rule out pregnancy if you have a sudden, dramatic change in your bleeding. Medications. Some meds, especially blood thinners, can naturally make your period heavier. Intrauterine devices, IUDs. The copper IUD is famous for causing heavier, more painful periods, especially when you first get it, though for some people this can last. On the flip side, hormonal IUDs are often used as a treatment to make periods lighter. Infections and inflammation. Pelvic inflammatory disease, PID, is an infection in the reproductive organs that can cause inflammation and lead to all sorts of bleeding irregularities. When to see a doctor just because heavy periods are common doesn't mean you have to accept a life of discomfort. This is where you become your own biggest health advocate. It's time to schedule an appointment with your doctor if your periods have been getting heavier over several months. You're experiencing any of those signs of clinically heavy bleeding we talked about earlier. You're bleeding between your periods or after sex. The pain and bleeding are wrecking your quality of life, making you miss work, school, or things you enjoy. You have any bleeding at all after menopause? This is never normal and needs to be checked out right away. Now, some symptoms are more urgent and need emergency care. Go to the ER if you are bleeding so heavily that you're soaking through 2 or more pads or tampons in an hour, for 2 hours straight. Showing signs of severe anemia, like feeling extremely weak or dizzy, fainting, or being short of breath. Experiencing a rapid heart rate or chest pain along with heavy bleeding. Feeling severe pelvic pain combined with heavy bleeding. Empowerment and the path to solutions. Okay, I know that was a lot of information, and hearing all those possible causes can feel a little scary. But I want you to see this as a message of hope. It means your suffering isn't just in your head, and it's not something you just have to suck up. These are real, treatable medical conditions. The first step is getting a proper diagnosis. When you see a doctor, they'll start by asking a lot of questions about your health and your periods. From there, they might do a pelvic exam, run blood tests to check for anemia or thyroid problems, and order an ultrasound to look for things like fibroids, polyps, or signs of adenomyosis. Based on what they find, there are so many treatment options available. It could be anything from hormonal birth control to other medications that reduce bleeding, to procedures to remove fibroids or polyps, and sometimes surgery. The right path for you depends entirely on the course, your overall health, and what you want for your future. CTA and conclusion. So, what's the bottom line here? It's that you know your body better than anyone. If your period feels like too much and is holding you back, trust that feeling. Don't let anyone, a friend, a family member, or even a doctor, tell you it's just a woman's lot in life. A period should be a footnote in your month, not the main event. By understanding the real reasons behind heavy bleeding, you are now armed with the knowledge to have an informed conversation with your doctor and fight for the care you deserve. If this was helpful, please give this video a thumbs up and subscribe for more content that puts power back in your hands. And if you feel comfortable, share your experience in the comments. You would be shocked at how many other people are going through the same thing, and your story might be the little push someone else needs to finally get help. Thank you for watching, and go take care of yourself.